after having examined you, these are the things we know. I think a round implant's good for you.
Yep.
Okay. I don't think you're going to look too fake. Okay.
Yep.
Because you do have a little bit of that emptiness that you said before, and I think it's better if we get the round implants because that gives you that fullness and the cleavage that you want.
Yep.
And I don't think it's going to look too fake because I think we can get customise an implant that probably fits your dimensions better.
Okay. Right.
So so I think we need to go through the crease as discussed.
Yep.
I think dual plane is a good option for you because the thing with the round implants is if you put them straight underneath the gland, it suddenly comes down. So it's good to have the pec major just to camouflage the top. So
yep.
you do have a nice cleavage,
yep.
but you don't see the top of the implant.
Yep.
Okay. So dual plane, and I think roughly speaking, I think having looked at the catalogues, about a 350 high profile implant
yep.
is good for you. Now, bearing in mind the profile range goes from low to moderate plus, high, and extra high. Yep. And there's also ultra high, and I only use that for breast cancer patients because they've got no breast tissue and you need to give them that projection.
Yep.
So I think a high profile, about 350cc implant
yep.
would give you your desired results. Implants can either be silicone or saline, okay? So we're lucky in Australia that the silicone implants we have, we've got the latest generation, which is the 5th generation of implants, and the silicone gel is form stable. What does that mean? If I squeeze it like that, it returns back to its original shape, okay? The old implants used to be silicone gel, not form stable gel, so it was just goo, so it didn't keep its stability. Yep. Same as saline. You know, if you held a saline implant like that, it would lose its complete shape. Okay, so silicone implants good. What we know is they're safe. They've done lots of studies on the safety of silicone implants, and it doesn't increase your chance of breast cancer, nor does it increase your chance of getting other autoimmune diseases, as they once thought in America in the early 90s. An aesthetically beautiful breast, you want roughly speaking, you want the nipple halfway up the breast mount, okay? So if you have your implant like that, you want the nipple to be facing like this, okay? And with this particular implant, based on your body dimensions, that would work, okay? If you wanted to go smaller, you could go smaller, but then it may not fill out the pocket. If you go bigger, you put a massive implant in like this, then you don't have enough skin at the bottom of between your nipple and your crease, and it just won't reach. Okay? And that's when people have problems with breast implants. When the implant doesn't fit the body, and you try to make the body fit the implant. My friend had a 500, I want a 500. You know, it doesn't work. So how do we choose an implant that's customized to your body? It's like building a house. I use this analogy with my patients that have breast cancer. If you've got a house, if you've got a parcel of land that's 200 square meters, you can't put a 400 square meter house on it. So your footprint, your chest wall, if it's so big, you can't put a massive implant on it. It's just not going to fit. Okay? It won't be stable and you'll have complications. You want an implant that sits perfectly on your chest wall, not too small, not too big. And that will also give you the nice side boob. The side boob has nothing to do with the implant being there. It's having a perfect implant so that the breast drapes over it and then you can see the side boob. Okay. The immediate risk you have after the operation is a bleed. Okay. And a bleed is not a torrential bleed that you're gonna die of or you're gonna need a blood transfusion from. The bleed is you might bleed like 200 mils into the breast, and if it was any other part of the body, we just go, okay, well, maybe not 200. If there's a little bleed, you let it go, but around the breast, you don't want any blood. You want it spotless, because too much blood, or over 100 mils of blood around an implant can make it go hard. And afterwards, when people go, my breast feels hard, it's because blood, when you leave it, goes hard. It gets calcified. So that's why even if you ring me and you go, okay, this feels funny, one breast is bigger than the other. Have a look at it and go, okay, well, we'll make sure you don't have a bleed. Not that it's going to cause you any ill health, but it will create a hard implant. We don't want a hard implant. That happens in the first, say, 48 hours. Then next is infection. That usually, if it's going to happen in the first day 2 to day 7. What do you look for? Redness, fevers, and a bit of pain. Okay. I don't give you antibiotics to go home with, but I give you antibiotics while you're asleep, and then I'll wash the pocket out with some antibiotic solution to minimise that risk. You may have heard the word capsular contraction. That's where, Spice, she's helped us out today, is that scar or that capsule contracts down like this. Goes really, really hard, and that's why you need to change the implant, which is capsular contraction.
Yep.
Modern day implants say that it's 3% risk per year, so in 20 years you've got a 50-60% chance of getting it. Some people get it, some people don't.
Yep.
This week I've taken 2 women back to the operating theatre who had the implants 20 years ago.
Yep.
And the capsules like calcium were just scarred down to the implant and distorted the implant.
Yep.
They caused pain. So remove that, remove the capsule, put another implant in, and they're back to square one.
Yep.
Okay.
Awesome.
Good.
So they're really not any high risk at all, they're just things that can happen.
They're things that can happen.
Yep.
They're certainly not catastrophic, they're just a nuisance that we just have to deal with, and I know how to deal with it should you get a bleed or anything.